It's now 7:30. Welcome back to Morning Express. This is the way it is. We're looking at universal healthcare and the Devolution Conference fast approaching. Now, it is no secret that the healthcare services globally do not come cheap. You may know at least a family that has been driven into poverty as they spent all that they had on their loved ones for healthcare bills. With many such incidences, Makueni County government has taken the mandate to fulfill a constitutional right to its citizens. That is provision of the highest attainable quality healthcare affordability. Dr. Mercy Korir with that report.
In what seems to be a bold step, Makueni County government has taken the global call to provide universal healthcare coverage for all and localized it to benefit the estimated 200,000 households resident within the county.
Everybody in Makueni should be on this program, and everybody means anybody who is resident in Makueni for 6 months is eligible for this.
A plan that targets to provide healthcare at no cost at point of service delivery to the citizens of Makueni within the public health system or the public health hospitals.
With this program, Makueni County is addressing the affordability of healthcare, one of the 3 pillars to attaining universal health coverage.
My mother is diabetic. And previously, before I registered her with the universal card, I was taking her to private hospital. And it was very much expensive. The sugar testing, I was paying around 2,000, 3,000. And I was taking her for around after every 2 weeks.
We also had cases, actually many cases, of people who went to private facilities, went to national facilities, including Kenyatta, and they couldn't pay. And they were detained. And of course now again, the relatives came to us asking for us to pay, to help them pay for medical services. We had many cases of people selling land, of the people selling their cattle, so that they would be kind of impoverished.
These stories are similar to those of many other Kenyans who have been driven into poverty due to catastrophic out-of-pocket expenditure on health.
Since the beginning of this program, we have even seen the health-seeking behavior changing in the county. Because right now there is no financial burden that stops our citizens from accessing the services in our hospitals, as long as they have membered themselves with the program.
These services include all outpatient and inpatient care as prescribed, including diagnostic tests and medication.
We did so well so that we had therefore the infrastructure to support free medical services in the major hospitals where actually people used to pay. We made sure that, we had theaters, we improved the doctors and the nurses, the health personnel.
This would be in keeping with the second pillar towards universal healthcare coverage, that is, availability and quality of healthcare services.
We implement a fee for service. So every client who comes to the hospital, they are able to be treated. They are given a receipt, and the receipt is billed to the county government or to the UHC fund, which now we reimburse to the hospitals for their operations.
The program has even extended to cover the first 10 days of mortuary bills, just in case a loved one passes on in our hospitals when they're being treated.
They pay 500 shillings. These 500 shillings caters for the principal contributor, the spouse, and children below the age of 18 years. And this should be able to give an annual cover for the household.
The case of Makueni has demonstrated that this is not a pipe dream. It can be done. One needs to make sure that there are facilities, there is staff, there is equipment, and then there is a reliable budget. We are happy that many counties are coming to us to benchmark.
Dr. Mercy Korir, KTN News.
Right, so some creative ways that counties are coming up to ensure that they do what they can. And Mr. Morara, you had referred to some of the amounts or creativity that has been employed in some counties. We have Makueni and Laikipia that seem to be doing something about it. Yeah. In Laikipia, it's basically a drive to have more of their residents registered on NHIF. On NHIF. Mm-hmm. And maybe before we get into some of those details, your thoughts on whether devolved health has worked for Kenya so far?
Michael, it's not only devolved health, it's generally devolution that has worked for Kenyans. Mm-hmm. And I like saying this, you know, the former chair of the Devolution Transition Authority that was charged with the mandate of midwifing, devolution and all this, used to say one thing that I'm very fond of repeating. If devolution doesn't work, there will be a revolution in this country. Mm-hmm. So devolution has worked. It has to work, and it has worked. For me, really, even the latest surveys that were done by Ipsos Synovate show that a good number of Kenyans have a lot of faith in devolution. So devolution is the way to go. It has worked. If you look at the latest figures, especially from the counties, it is very encouraging to know that at 39 counties, looking at the 2016-2017 financial year, allocated a huge percentage of their budgets to healthcare. So 39 out of 47, that means only maybe 8 or so counties were spending less on healthcare, but as a budget item. But for all the other counties, healthcare was the biggest budget item. The challenge comes in the manner in which this amount of money that has been earmarked by the counties was being spent. Because if you look at the total budget, that translated to about 32% of their budget. They still have absorption challenges because they could only absorb up to 62%, which means we need to work on the absorption. The other challenge is that most counties are talking about, this is the time they're laying the groundwork, the infrastructure. So a huge chunk of that amount of money, actually 48%, of the money that these counties have allocated to healthcare has gone into building healthcare facilities and infrastructure. That has left just a fairly small amount of money to go into buying medical supplies and equipment. Some of that, like 12%, has gone into renovations of the existing facilities. And then only a very small amount has been actually devoted on the statistics that are available to maternal health care. That was about 4%. So we hope that once the foundation has been laid and the facilities are in place, then we now start shifting the investment of that amount of money. We shift that to now ensuring that we pay the medical personnel well, ensuring that we devote more money to actually treating the patients and all that. But so far, the statistics show that the counties are doing really well. Being led by Nyeri, which is investing 40% of its budget on healthcare. And then there are about 18 counties that are investing either a third or more than a third of their budget on healthcare. And in that pack, the category is led by Nyeri County at 40%. Now, the bottom three closing that pack of 18 include Makueni, and we've seen what they're doing. They're only investing 29% of their budget, and with 29%, they're able to do what they're doing. The other two are Siaya and Kericho. So for me, really, devolution is the way to go. There could be problems and challenges here and there, but if you look across the board, counties have significantly invested in healthcare. It is, as I said, at this point in time, just in infrastructure and all this. We hope we now start focusing more on the personnel so that we reduce these issues and incidents of constant industrial action overpay. Because one of the parameters in terms of availability includes the fact that the people who work in the medical personnel and all this must be paid competitive rates. That is a standard that we have to apply. So very excited that we are doing this the right way. Most of the counties are investing. Yesterday, I had the pleasure and privilege of talking with the Speaker of Turkana County, and he told me they have 30 wards. In those 30 wards, they have actually ensured that they have 2 health facilities in each of the wards. So they need to be followed by what we are calling devolutions and resources following the functions at the county level. We still have a challenge, as you rightly noted, between the national and the county government in terms of whether sufficient resources are following the functions that have been devolved.
Absolutely.
Yes.
And of course, then the question for the residents, because at the end of the day,
yes,
it is meant to benefit the Mwananchi, and the reason why it is even being devolved is to bring those health facilities, health solutions closer to the Mwananchi.
Absolutely.
The investment is one thing. Do you think that has translated to Mwananchi actually feeling that investment being put place? And we do appreciate that this is something that would not happen overnight. I mean, even if you bought machines and put
yes,
in all the county hospitals, for them to be effective and working takes time, takes training. But do you think that is translating to the common Mwananchi feeling that effect yet?
Really, like I said, we still have a long journey to walk. And the picture is mixed across the counties. Let me just give the viewers a few examples. Let's look at the issue of health coverage. In this country, we still have a very low level of health insurance coverage, with only about 20% of Kenyans on health insurance coverage, which means 80%, and that's a significant number of Kenyans, are not on some form of universal healthcare coverage. So we can't say that Kenyans are really significantly benefiting. And if you look at those numbers, the 20% who have it, again, if you disaggregate them further, it shows a bias to those ones who live in the urban areas.
Correct.
For example, in the urban areas, they're likely to be about 3 out of 10 people have some health insurance cover. The worst are in the so-called traditional areas that have been marginalized over the years. Look at the case of Wajir. How many people have health insurance in that county? 0.2%.
Wow.
If you go to places like Marsabit and Mandera, it's barely 1.7%. It's less than 2%. So again, the picture is mixed. I like what one of the interviewees on the clip that you showed was saying. It means a lot of Kenyans cannot still really walk into a health facility, mostly because they can't afford it to get a medical care. What does this mean? It means a lot of Kenyans have very bad health-seeking behaviors. And this is borne out by the statistics that we have out there. If you look at the county statistical abstracts, for example, you will be shocked, like some counties like Tana River and Kajiado, they list as one of the top 10 causes of death, sudden death. So if you have sudden death listed as one of the top
causes of death.
10 causes of death, that means that in these counties, it could be a case of really bad or poor health-seeking behaviors, and the residents, the Kenyans in these counties, cannot afford to go to a health facility and really get the treatment that they want. So a lot of challenges still remain. The coverage is still really, really low, and we hope to move it, if we can move it from and flip the figures so that we have 80% coverage and 20%, we work towards that. Again, like you said, in the spirit of progressive realization of rights, so that ultimately we have all Kenyans covered. But now, very, very small numbers. Yeah, it's still quite a challenge.
All right. And of course, we do know that the president has been in the forefront of this campaign. In fact, on the Jubilee 4-point agenda, it's universal health care. And therefore, one would like to assume and believe that the president and the Jubilee government are championing this. Let's listen into what the president had to say.
I turn to the third element of our big four, and that is universal health care. Indeed, in our conversations, it was obvious that the cost of health care still stresses many families. We can end that pain by providing medical insurance cover for every Kenyan within the next 5 years. That shall entail major policy and administrative reforms in the medical sector to ensure that all of us have access to quality and affordable medical cover by 2022. The plan would of necessity require strong collaboration between the National Hospital Insurance Fund and our private sector insurance providers. We will review the rules governing private insurers to bring the cost of cover within the reach of every Kenyan, to protect both government and Kenyans from fraud and abuse, and to let private insurers invest more in covering Kenyans.
That's what the president had to say. Do you feel that this is something that finally the government is serious about, or was this just another speech that was given? Because unfortunately with politicians, it's difficult to tell when their promises are followed by action or it's just another speech given.
Well, Michael, one of the advantages we have as a country is that we are not engaged in very vicious debates as to the merits and demerits of universal healthcare. As would be the case, for example, in the US, a very rich country, where still people are haggling and debating on whether they... In Kenya, we seem to be across the board, from the government, at the national level, the county level, like I've shown you through the statistics and all this. There is a genuine commitment and desire to really make healthcare available to all Kenyans. But then we have to go beyond that genuine commitment and desire to ensure that we invest adequate and sufficient resources into healthcare. There is no reason why for a long period of time our allocation on healthcare has been hovering around the 5% mark. So what the president said is, that's a good speech. It's really encouraging. But then let's see progressive years, money being invested to ensure that then healthcare is universal for all. And I like what the president also said when he went to, was it in Bomet County, to open the eye clinic. One of the problems we also have is how we use our resources. And the president was actually very forthright and said, I've seen what these wazungus have shown me. With 300 million, look at what they've come up with. So I hope we'll be able to invest our resources prudently, because again, let's not forget this health sector has been bedeviled by massive cases of corruption. So if the money was used adequately and properly, then we'll start moving towards the right direction. Let's see how the government translates some of the statements that they have already made in terms of ensuring, as a beginning, that certain categories of people. It was good. We started with the maternal health care in 2013. But again, as I say, that has challenges. We need to come up with clear policies and guidelines on what that means. It is good that the government has said that the elderly, I think people who are 70 and above, will all get NHIF coverage. It's also good that, especially focusing on children and adolescents, the government has a plan to roll out health insurance coverage for the pupils in high school, the students in high school. So for me, these are very good initiatives and declarations of intent from government. What will make them meaningful is when they translate from the public statements to the actual implementation, where resources follow those statements that are being made by the president and all the other actors, including the county governors. Yes.
Now, you bring in another interesting aspect which Kenyans must appreciate and realize that we are all part of, despite the fact that we expect our leaders to deal with it, and that is corruption. And of course, it affects the resources that possibly would have gone into proper and good use of healthcare. Just last year, we had a huge scandal surrounding the health ministry. And of course, these are questions that bedevil us time and again. Your thoughts on whether we finally can slay this dragon of corruption, because it affects it. It has become a matter of life and death, as a matter of fact. Maybe we should start even by demystifying it, Michael. The moment we keep on talking like PLO about a dragon, dragons are mythical figures. See, corruption is actually being conducted by people who are flesh and blood, and they are not even dragons. Possibly people we know. Yes, and people we know. So let's reduce them from that mythical realm of dragons to start dealing with these are actually people who are engaging in economic sabotage. They are people who are really making this country stagnate. And one of the debates we've always had is, if you look at even the African culture itself, we didn't have very kind words for people who were thieves and stealing public resources. They were called for what they were.
they were thieves. We did not celebrate them. So we need to stop sanitizing the public officials or any other person who is actually engaged in this vice by coming up with a very punitive approach. For example, look at what's happening now in South Korea. Leaders should know, especially those ones who hold public office, that corruption has consequences, that there cannot be impunity for acts of corruption. South Africa, a classic case. Now Zuma is sitting behind the dock there answering to corruption charges. Right. And in this country, let us start talking about men and women who are corrupt, because we don't have dragons who are corrupt. So let's actually confront the men and women who are actually stealing our public resources and funds, so that this money is invested in saving lives, it's invested in ensuring that we have a top-notch, first-class healthcare. Makueni and Laikipia have shown that it's possible. Let's learn from them. We don't need to go to any other external benchmarking trips. It is happening locally. If we use our resources prudently and we cut corruption, I think it can be done.
All right. Now, your advice to Kenyans, because corruption, of course, we know that would be dealt with from a government level, but the reason why it is so thrive in this country is the fact that we all seem to have, in one way or the other, our hands in the till or in the cookie jar, even as residents. How serious is it for us to realize and appreciate that, so that we can start from wherever we are to deal with corruption?
It actually speaks to the governance of our institutions and how we manage them. Because part of the reason why people are driven into corruption is when you have inefficient bureaucratic systems. So people really want to facilitate or help the system function. Or short-circuit. Work better for them. If we had standards and we've started doing that, service charters everywhere. When you go to a place, you know that this service is free. You're going to get this service within this number of days or number of hours. Then it becomes easier for Kenyans to work in an environment where their services are predictable and where the incentive for corruption is significantly reduced. What we have here is our bureaucracy doesn't seem to be depersonalized. It is very personalized. And the people working in most government bureaucracies think that by giving you services, they are giving you a favor. No, they are not. Our constitution is very clear that public officers and state officers are there to serve Kenyans, and they are not there to be bosses. It's not the other way around. So for me, really, the moment we are able to make our institutions function, the incentive for corruption will be significantly reduced. As things stand now, high levels of corruption are an indicator of a highly inefficient bureaucratic system.
All right, as we get to the tail end of this interview, specialized healthcare, especially on the county level. Referral hospitals are basically meant to be devolved and also at a very close level, close to the Mwananchi. Do you think that is happening? Because we still seem to have congestion in the main referral hospital. And of course, Kenyatta Hospital bearing the brunt of that, given that it is the one that's most well known.
Yeah, I think it could speak to the issue of lack of a proper referral mechanism from the county to the national referral hospitals. And one of the things that we're doing as a commission, really, following the Kenyatta National Hospital debacle, was we wanted to have a very robust conversation with the Kenyatta National Hospital and even do an audit to look at the counties that are actually referring more people to Kenyatta National Hospital and the reasons why these counties could be referring those people to Kenyatta National Hospital. So that is something that we're still having conversations with the Kenyatta National Hospital, and I hope it will happen soon. But again, even at the county level, in terms of availability, do we have a situation whereby we've made the standard whereby the health facilities should be within a radius of 5 kilometers to the citizens, so that we improve their health-seeking behavior. When they're sick, they're able to go there. I have a sense that one of the reasons why people end up being referred to the the big referral hospitals is we only get to diagnose them about the ailments they're suffering when they're at a very advanced stage, when the local facilities cannot handle the same. So if we have interventions early enough, if we have facilities that are actually able to improve the citizens' health-seeking behaviors, we will significantly then reduce the burden that we currently place on our national referral hospitals.
All right, we are out of time, Mr. Morara, and maybe your closing remarks and your closing comments.
Closing remarks, the right to health is a human right. Like I said, health is not a commodity, it is a public good, and we must do all we can as a country to ensure that we move the numbers of the Kenyans who are on universal health coverage from the current number, from the current 20% to really decent percentages. The president said by 2022, all Kenyans should be on universal healthcare coverage. That is a good projection. So let's see how we move, because this is 2018, 4 years, whether we can close that 80% gap. That will require a lot of massive investment in the health sector. That will require that we cut down on issues of corruption. That will require that the national government sends more money to the county governments so that they're able to carry out their healthcare functions. And that will really require our commitment as a country to a healthy, productive citizenry, which is useful for all of us. So for me, the right to health is a human right, and we all deserve to have that right guaranteed as provided for under Article 43 of our Constitution.
George Morara, Vice Chair, KNHCR, thank you for joining us this morning and looking at health, and more specifically the universal health care that the government is trying to achieve as we continue to look at devolution and the Devolution Conference, which is fast approaching. For now, at 4 minutes to 8, we're going to take a short break. This is Morning Express. Do stay with us. We've got Sports Chat.